Good afternoon, everybody. We're coming to you a little later today so that we can make sure that in no way would we interrupt the funeral of George Floyd. I think it's important to that family and for those that had the opportunity to watch, to listen, and hopefully to hear, to ensure that those are the voices that are heard today. At our next press conference on Monday, we're going to be talking about steps that we're already looking at taking, commitments that we have as far as equity, whether it is in healthcare or in other areas, so that people know that not only are we listening, but we want to get moving and take action. Today, given that service, I'm just going to give a short report on COVID-19. I'm going to make two quick announcements, and then we'll take questions. Today, we've got another day of pretty high numbers. Again, it's a little too early, but they are elevated from where we were going for more than a week. Today we're reporting 295 new cases of COVID-19. That brings our total number of cases in the Commonwealth since the beginning to 10,705. The 226 of those are probable. The rest are all lab confirmed. We're now up to a total of 262,714 total tests. That ranks pretty well in the country. People ever hospitalized, 2,332, currently 518. Ever in the ICU, 954, currently 67. It's a very good number, very low. And the number recovered, 3,303. New cases by county, 149 in Jefferson, 14 in Kenton, 14 in Warren, 13 in Boone, 9 in Clark, 8 in McCracken, 7 in Davis, 5 in Fayette, Grayson, Henderson, and Todd, 4 in Allen, Christian, Franklin, Harrison, and Monroe, 3 in Campbell, Logan, and Madison, 2 in Boyle, Hardin, Marion, Ohio, Oldham, Pike, Scott, and Woodford, and 1 in Barron, Bell, Bourbon, Boyd, Carroll, Clinton, Gallatin, Grant, Greene, Lincoln, Meade, Russell, Trigg, and Webster. And today, sadly, we've lost another 8 individuals to COVID-19. Let's remember that this is an aggressively spreading, deadly disease, and we continue to lose Kentuckians to it. Our total number of folks that we have lost is now 458. Those are 458 families, 458 communities that are reeling. We need compassion in our world and in this Commonwealth now more than ever. So turn on those green lights, ring those bells tomorrow at 10 a.m. And let's remind these families, let's remind our neighbors, and let's remind ourselves that we are called upon to be good people that care about one another, listen to each other, and are there to comfort one another in our pain. The 8 individuals include an 86-year-old woman from Metcalf. That one is currently one of the probables. A 71-year-old woman from Jefferson, a 92-year-old man from Kenton, an 82-year-old man from Grayson, a 92-year-old and a 91-year-old man from Jefferson, a 72-year-old man from Franklin, and an 87-year-old woman from Boone County. On a day like today, and after the service that I hope just about everybody watched, we again see the disparities and the racial impact of this virus. And it's not that the virus that does it, it's our society that shows how unequal access, not just to health care, but to so many other resources, results when you're in a pandemic in death. Cases, 84% non-Hispanic, 16% Hispanic. Race, 74.17% white, 14.51% black or African American, 5.25% Asian, 5.67% multiracial. In deaths, it's 96.68% non-Hispanic and 3.32% Hispanic. And in race, 79.47% white, 16.91% black or African American, 1.69% Asian, 1.93% multiracial. This, and for so many other reasons, you're going to see this administration fully committed to trying to create equality in our health care opportunities, whether that is access, whether it is coverage. It is more than time. And for a governor that believes health care is a basic human right, it's time for me to step up and prove it. And it's time for this administration to not only believe in it, but act upon it. Two other quick announcements. We reached an agreement late yesterday with NASCAR, which is going to run 4 days of races in July without fans. That is July 9th, 10th, 11th, and 12th. We'll have more information on this on Monday. NASCAR itself has a message for us that it's not appropriate to play today, but we'll show that on Monday, and we'll talk through a little bit more of what that'll look like. The other announcement today is our June 8th opening. We've been able to add HHR, the Historical Horse Racing facilities. They provided a very compelling plan where we believe that people can stay safe. With that, obviously our country is still going through not just a worldwide health pandemic, but a demand for justice and equality. We've talked about that a lot at these press conferences today. I think the best thing that I can do is let the words of Mr. Floyd's memorial lead the way and renew our commitment to doing what it takes to make sure that the world looks different moving forward. All right, we've got Stu Johnson. I thought we had Morgan Watkins. I don't think we do now, unless, there you are, Morgan. Lawrence Smith, Nick Oliver, Tom Latek. We got Joe Ragusa and Mike Valente. Why don't we start with Tom?
A couple pieces of legislation or legislative action that was proposed by Louisville Metro Council President David James today at the committee hearing. One, to legislation that would severely limit the use of no-knock warrants, and another one to give police civilian review boards subpoena powers. What are your thoughts on those?
The question is David James, who is a Louisville Metro councilman. I think he was the president of the council last year. I'm not sure if he still is currently. He is, and a former police officer himself. Today testified here in Frankfurt, and let me say that that was an act of leadership by the legislature. Now, I'd communicated with some of the legislative leaders that given that the judiciary was meeting, that it was the right thing and the right time to hear voices, such as the ones we heard today. And I think it was a real act of leadership for the legislature to push some other things off and to have that testimony today. I think coming from David James, we ought to strongly consider both of those pieces of legislation. When we see what occurred with the no-knock warrant and how it was served in the case of Breonna Taylor, it demands change. I mean, anytime a tragedy occurs, we ought to learn from it. And I think everybody involved believes that we ought to at least look at those policies and procedures and find out how we do things better. And then we've got to make sure, again, that all of us, and our police included, want to do the best job at our jobs that we possibly can. And I just hope that we can all find at least common ground and commitment to be better, commitment to do better. I believe that that's something that everybody should embrace.
The state of federal government What kind of budgetary actions do you propose going forward to invest in community college?
The question is what type of, and the question is from Mike, is what type of actions can we take to invest in our communities of color? We're going to have some announcements on that in terms of health care on Monday. I believe our Lieutenant Governor already started talking about it in terms of education, but I believe that there are more dollars also in workforce. And it's important when we make these investments that it's not just outsiders and outside money coming in, that it actually helps build the community up, builds wealth inside the community, uses community organizations and community pillars that already have the trust, but not always the resources to lift up a community. We got to make sure that those are that we use, not that we use, that we lift up those organizations to help create more opportunity. Now, the changes that we've got to see in inequality are many, but they certainly include health care, economic, justice system, and I think that what I'm hearing as I try to listen is that this is both about specific justice in the Breonna Taylor case, but more broad justice, type of justice we talk about on Sundays where we're all supposed to be each other's neighbor and we're all supposed to believe that everybody has real opportunity in this world, and then we're supposed to work to make sure that happens. All right, we'll go back.
195 new cases. What's your level of concern right now in terms of the broader picture?
295 cases. Again, it's not enough data to say that I am concerned or to raise a high level of concern. Again, we have a lot of tests that are out there. We are testing more asymptomatic people than ever. Our ICU current beds are really low. So what we're going to see is we test more, and as there are more contacts that people have, we're going to have more positive tests. Now, I hope that they're lower than this, but we're going to have more. What we're going to be able to do is find people who probably already would have tested positive if we were testing asymptomatic folks, and or we're going to find folks that because of the expanded contacts now have it, but are otherwise healthy. We can isolate them and not spread it further. But we're going to watch the numbers as we continue. We're going to keep watching them. Okay. President Trump has called on governors to dominate the streets and said he would deploy the military to locations around the country where local officials are unable to control the unrest. Then there's some statements from some other folks. We have peaceful protests that are going on in the city of Louisville and around Kentucky. There are some individual bad actors not connected to these protests that are committing crimes. There are bad actors out there that commit crimes when there are no protests. I do not believe that we have the type of unrest that at least the president seems to be referring to, and to use a terminology like dominate in this situation, I don't think those are appropriate words, and I don't think that they help us in showing that we are listening and want to be a part of a better America and a better Kentucky moving forward. Lawrence.
What is the regulations going to be regarding historical racing? What kind of rules would have to follow?
The question is about the requirements in historic racing. It's going to be social distancing. It's going to be the 33% capacity, and there's going to be the cleaning, the hand sanitizer stations, but they actually provided us with a proposal which will be most of the requirements. It was a good proposal, and we think it's going to help us to do it safely. Stu?
Testing, what percentage of Kentuckians would you like to see tested by the end of the year, and what do you think it will in essence be by the end of the year?
Well, that's a tough question to project. How many Kentuckians would I like to see tested overall, and where do I think it'd be by the end of the year? Dr. Stack, you want to? Sure. I will say I want as many Kentuckians possible tested regularly. until we have the vaccine. You know, the White House wants, I think, 2% per month of the population. We're already over that. Again, the more, the better. It keeps us safer. But now you'll get the scientific answer that will correct everything I've said.
No, Governor, you had it all right. So but our understanding and our recommendations will continue to evolve as we go forward with this disease and we learn more. So at present, the proposed suggestion is to test at least 2% of your state's population every month. We already go well beyond that at this point. With our arrangement with Gravity Diagnostics, we already can have the capacity to test 5,000 people a day, 6 days a week. That's 30,000 people a week right there, which is about 2.7% of our state's population. That doesn't even include all the other labs who are doing testing. So we are well north of what we need to be at for the current yardstick. But what we will end up probably doing is calibrating how much testing we do relative to what the disease burden is. And there are other metrics looking at it from a different direction, which would be keeping your positivity rate less than 3% if you can. So if you get to 3% or less, the general thought at the moment is that you are testing enough people to find the positives as completely and quickly as possible so that the contact tracing has the best chance of being successful. So a minimum yardstick would be to keep your positivity rate less than 10% now, but we're well beneath that. And again, we keep referencing publicly available sources. If you go to covidactnow.org, you can see what our transmission rate is. They use our publicly available data and what the general positivity rate is of our testing. And so we are currently well above where we need to be in a successful manner. And I think we'll address this as we go forward, how much testing needs to happen continually, but it'll evolve month to month as we learn more and see if we have any resurgences.
James, can you put the Kroger signups up? I will tell you one thing I'm concerned about is testing fatigue, is do people continue to go to get tested? Well, if you're running a business, you ought to want your employees to continue to go to get tested so that someone who's asymptomatic doesn't spread it throughout the office or the factory or the environment that they work in. It's important that we continue to get people tested, and sign-ups, at least in the Kroger sites, are slowing. That's a concern for me. We have got the ability to reopen successfully under the metrics that have been provided by the White House and others, but we got to have people buy in and to do it to make sure that we can do it safely. Morgan?
The fact that you did send the National Guard to Louisville during the protest in response to some of the kind of property damage and stuff that's happening there, do you support using the military to quell protests and unrest in any situation?
Well, I think that there is a big difference between the U.S. military and the National Guard. The National Guard are our friends and neighbors. They are part-time, they work in our communities, and then when needed, they are called to service. These are Kentuckians that care about our community and that ultimately answer to state officials that we can hold accountable. I believe that there is a big difference there. We do not need the U.S. military in Kentucky. We believe we have a situation right now that is peaceful, and you know, during the I think during the service today, what I heard is peaceful doesn't equate to quiet. Those aren't the same. What we have is nonviolent protests, but people giving voice and people giving voice strongly. And right now, you know, I believe that we do not need the U.S. military in Kentucky. Nick.
I guess concerns from local health departments in terms of contact tracing. If, let's say, somebody is confirmed to have COVID-19 that was out of protest. Obviously, that's a big challenge.
We have not, to my knowledge, received any information suggesting someone that was at a protest is positive for COVID. Now, you wouldn't typically see it until later at this point, but we don't have any information on that now. But if you're willing, and you know you're out with that many people, make sure you get tested. We've got sites in our major cities, in Louisville and in Lexington, this is about, I know it's about justice, and it's about public safety, and everybody wanting to feel like public safety works for them and their community. Part of public safety right now is protecting each other, so getting a test in the coming weeks, I think, will be really important. Karen Czar, is there any indication that David McAtee had something in his hand besides a weapon? When we have all of the evidence, again, together, it's important that we don't look at any one single piece. I talked about this the other day, that we're able to present a comprehensive picture. That's what our Kentucky State Police CERT unit is doing right now. I believe that when we provide another report and when we have the opportunity, there's going to be a lot of different pieces of evidence that we can lay in front of the people of Kentucky, and they can look at it, because again, what I believe that the people deserve is the truth. And whether the truth, I've said this before, is good, bad, or ugly, I trust the people of Kentucky with it. And even when all that's in, it doesn't mean that there won't be other questions, and it doesn't mean that those questions aren't valid and shouldn't be discussed, but my goal is to get you the truth. We're working fast, but I want it to be comprehensive, and I want it to put all of the facts in context. Tom.
You've spoken, when you talked about moving the unemployment insurance out of workforce development and education workforce development, that there are going to be some changes. I understand there have been changes in unemployment insurance in the way of personnel. What can you tell me about that?
We are working right now on some changes related to personnel in UI, that's the unemployment area. We want to make sure that we respond to issues that are out there. Now, I will say that the group has processed a historic amount of claims. I actually got a letter from the chamber today on that I believe we've processed almost 90% of claims within the time period we're in, with a historic number being filed. But that other 10%, they're struggling too. Now, I got to remind everybody that this isn't just state law. To qualify for unemployment, we got a lot of federal law hurdles they set up, and a lot of those hurdles have made it hard for people to get unemployment. And we can't ignore federal law, and we got to go through all those hoops. And I think people can understand that. I think the frustration is it isn't always communicated to them, and that's in part because of the high volume that's out there. So if this was normal months of unemployment, I don't think things would look like they do right now, but we still got to be able to learn and respond even to the amount of historic claims we've seen.
Was asked earlier today at a press conference in Louisville, but I'm not sure it was addressed, so I'll ask you. The Louisville mayor put a compilation of footage of mostly black men looting, and then asked for the public's help. Considering that, just a couple of months ago, 2 white men took it upon themselves to chase down a mock arbiter and kill him, do you have any concerns that they're putting black men in danger?
Well, I have concerns right now, where tensions are generally, and I think that we all have to be mindful and thoughtful about how we talk about things, but we ought to be anyways. I think that, again, listening, what I hear, I think, is the truth, that race still permeates just about every part of America. And just because I might not always be aware of it doesn't mean it's not true. And understanding and listening to areas that I am not aware of and should be. Opening my ears and opening my eyes is something that I think is happening all over America. If we're going to be better, we got to be honest with ourselves, and we got to learn moving forward.
Issues with race in the Capitol Rotunda, there is a statue of the Confederate president. What are your thoughts about that statue, and do you think it needs to be removed?
I believe that the statue of Jefferson Davis should not be in the rotunda and should be removed. Stu.
Lexington Mayor Linda Gordon is forming a group to people of various walks of life that will be listening to the community, then making recommendations related to race and equity, police issues. Should that happen in all?
commend Mayor Gordon, who is putting together kind of some listening groups. What I want to do here in the state level is to put together action groups. I want to make sure that we have those in the private sector and in government that can enact the change in direct communication with those that can identify where it's desperately needed. We're working on a plan on that in healthcare, and just broadly, it's about putting the payers where the money is. And that's everything from Medicaid at the state to the insurers, with the providers, which are our hospitals, our primary care centers, and with the community that is seeing the inequity, especially in terms of COVID. And yes, there'll be some recommendations to come out of that we may have to change state law, but I want action. I mean, if we put all the right people in the room, where the money's coming from, who can provide the services, and those that can give true voice to where it's needed, we ought to get something done. We ought to get something done in the short term. And I know that there's lots of work that will be required for the long term, but there are things that we can get done, and we should be able to get done quickly. And the last thing that I want to tell anybody is that we're forming a committee that will come up with recommendations that at some point we will act upon in the future if there is still the motivation behind those that would act on it at that time. I want to get some things done. I think we're hearing the voice of fatigue and frustration. I want to hear that, and if I'm hearing that, it means that I have to make sure that I'm enabling action to address it. Have I ever considered doing a separate count of people who have died from multiple issues, including the coronavirus, because it seems that would be a more accurate way to keep track of the number of deaths? Almost everyone that has died from the coronavirus has underlying health conditions, and many of them are serious and significant health conditions. That's what this virus does. This virus doesn't pick off, with a few exceptions, the healthiest among us. It finds those that, with modern medicine, while they may be sick, they are still here with their families, and to many of them, it kills them. I don't want to overcomplicate in our numbers what this virus does. Yes, there are other causes, but without this virus, in most cases, we do not believe that the death would be there. And there may be some that say, oh, well, that's conflating it. No, this is killing people. And if we don't take it seriously, and if we pull out our numbers in different ways that let us rationalize that it's not a problem, then we don't do what's necessary to defeat it. Lawrence.
Cameron today recommended 2 lawmakers that they take steps to curb check and balance the governor's emergency powers, saying the 1998 law doesn't anticipate what we're going through right now. Your response to that, please?
Well, the question is, Attorney General Cameron recommended laws to curb a governor's ability to respond. What it would have done is prevented a number of the steps that we have taken to address the coronavirus. Folks, it's ultimately up to you, the voters, but can you imagine? Could you imagine if the Attorney General got his way and there were impediments and we could not have taken the actions that we did? I mean, do you remember the graph that we put up where by a week in May, we would have had 16,000 new cases in 1 week? And do you also remember when we walked through the presentation that we've done the same thing that almost every other state, Democrat and Republican, have done? You know, it's after we've blunted the curve and crushed the curve that politics comes back into it. But if a future governor did not have the power to take urgent action when it's needed, it would have resulted in significant additional death. It's as easy as looking at the UK, the U of L, and the CDC studies. Those are all of our major authorities, and saying it saved thousands of lives. So do you want to accept testimony and put into action laws that would have prevented us from saving thousands of lives? I've said I'm done with politics. It doesn't mean others are. But I'm done with it. And we can have hearings. Everybody can say what they need to say. Every action I've taken, I've recognized how serious it is. And I've recognized different damage than it would do. But every action I've taken is for the life and the safety of our Kentuckians. And now it's about power and the legislature or the governor or the rest. Every decision I have made is for the life and the safety of Kentuckians. And I think by and large, I hope the people of Kentucky agree with what I've done. And afterwards, we can look at it, we can criticize it, and in the end, if our success continues and we keep our death rate as low as we can and we keep people healthy, if people then want to say we overreacted because we were successful, I can live with that. I can absolutely live with that. So, Morgan?
Earlier about the Jefferson Davis statute, do you actually have the power to remove that, or is that not something you're able to do?
We're looking at that. I know there have been different actions in the past, but listen, I just want to make the statement that I believe that Jefferson Davis statue is a symbol that divides us. And even if there are those that think it's a part of history, there should be a better place to put it in historic context. And right now, seeing so much pain in our state and across our country, can't we at least realize that in so many of our fellow Kentuckians, people that, again, we're talking about compassion in terms of COVID, we ought to have compassion for all pain. Can't we understand that it is, in the very least, so hurtful to them, and doesn't that at least justify it not sitting where it does right now? I think I don't think it should be in the Capitol Rotunda. And the question is on schools in the fall. I still hope that we can have a regular opening for school, but it is going to have to look a little different. I saw some testimony that seemed to push back on everything that we would ask schools to do differently. If schools don't do things differently, they have an outbreak, you shut down that school. I think we've seen that in France and some other places. My hope is that we can start school normally in the fall, but those schools that are willing to embrace the things you need to do to prevent the spread are likely going to be able to continue and not have interruption. School systems where they testify or push back against the things that we know will prevent the spread and have an outbreak, well, they're going to look at shutdowns. And I think that the people in each district is going to be able to evaluate how the system works. Now, we are still working on guidance, and we're still seeing where this goes. Right now we are in the early part of June, and a number of different things could still happen with this virus. It could come back and continue to decline. Summer and heat, because it's just now getting really hot, could have an impact on it, though we're not certain that that's the case. Or we could see a resurgence in it because of reopening. So there's still really important data that we need, but my goal is for us to have our kids back in school in the fall. All right, I know we went short tonight. I'm sure everybody is appreciative of that. We'll be back on Monday. We'll provide a number of updates. If there is a need to have one of these before then, we will. Let's just remember that a lot of people are hurting, not just because of COVID, but because of everything else going on in this Commonwealth and in this world. Let's try to listen to each other. Let's remember that every Kentuckian is a Kentuckian, every single one, and all of us matter, and especially when we're hearing so many voices of frustration and pain and anger. We ought to listen, and we all should want a better world, and we should all figure out what we can do to make it happen. Thank you very much.